Hi, Terry Schoenfeld for UAB School of Medicine. Clinical practice guidelines can often improve the quality of care that we provide our patients, but they're not without limitations and problems. In this video, I'll go through some of these limitations and problems which can lead to untrustworthy, biased guidelines.
So as a reminder, the Institute of Medicine defined what clinical practice guidelines are a couple of years ago as statements that include recommendations intended to optimize patient care that are informed by a systematic review of the evidence and assessment of the benefits and harms of alternative care options. Now, guidelines go beyond just reviewing and summarizing evidence like a systematic review would. They convert evidence into recommendations or care. And because of that, as Alan Detsky says, this requires subjective judgments. And whenever subjective judgments are used, it leaves room for error and bias, and therein leads to some of the problems of clinical practice guidelines. So these are my views of what are some of the limitations of clinical practice guidelines. We'll go through each of these individually. I've written on these topics before in a variety of editorials, but I'd just like to hit some of the highlights. So conflict of interest is probably one of the biggest limitations of clinical practice guidelines, and the two most common are financial and intellectual. It is very common for industry to sponsor guidelines. If industry doesn't, usually a single medical specialty society sponsors a guideline, and you can hopefully see that that can lead to a financial conflict of interest. And unfortunately, conflict of interest seems to be very common on guideline panels. A variety of studies have shown different percentages, but probably one of the better done studies shows up to almost 90% of guideline panel members have some conflict of interest. And the problem is if we knew what these conflicts were, we may be able to interpret the recommendations taking that conflict of interest into account. But unfortunately, many conflicts of interest are not reported in guidelines, so you're left wondering if there's any conflicts in the recommendations that the authors make. And these conflicts of interest tend to get quote-unquote managed in a variety of ways. Everything from excluding members who have conflicts of interest up to just having people declare their conflicts of interest. But really, declarations of conflict of interest does nothing to really reduce the impact of that conflict of interest on the guideline development process. Many guidelines are very poorly developed and don't follow guidelines for developing guidelines. I showed this in 1999, and more recently Kung and colleagues in what used to be Archives of Internal Medicine, now JAMA Internal Medicine, published a study redoing sort of my earlier study, and unfortunately found the exact same thing, that very few guidelines follow most of the guidelines. And this makes you wonder how trustworthy the recommendations might be. Guideline panels often are composed of single specialty physicians. So, for example, a group of cardiologists only. And the problem is those same groups or types of physicians or panel members, doesn't have to be physicians, tend to share the same values and biases. And remember, we convert data into recommendations, and that conversion of data into recommendations is filtered through our prism of our belief system and biases. Now, there are too many guidelines that are focused on way too many issues, and we get lost in information overload. There seems to be a guideline for everything, and you lose the message in all the minutia. And there was an interesting study published in JAMA in 2005 that took what I consider to be a typical patient I see in my internal medicine practice and looked at guidelines that were available for this particular patient, and they looked to see how many medications and doses and costs, etc., would occur if you followed all the guidelines. And you can see this hypothetical patient would have to take a lot of medications multiple times a day, and I'm sure today it's even worse because we've come up with some other treatments for these diseases since this study was done. So really they're trying to cover too many things with guidelines instead of trying to cover the main areas that have a lot of variability in care. The other problem I see with guidelines is that they have a one-size-fits-all mentality. They're way too directive. Instead of being a guideline and guiding you on things that could be done, they try to tell you what you should do on everybody. And unfortunately, just like guideline panels or single specialty membership, most guidelines are single disease-focused guidelines. And patients have multiple comorbidities usually, and these guidelines leave almost no room for clinical judgment. Now, there's also too much expert opinion built into guidelines. Now, it's okay to have expert opinion because often we need opinion when there's a lack of evidence, but the problem is we should not label expert opinion as a guideline. It's just that, expert opinion, or call it a consensus statement. But guideline is a very strong term that is often then converted into a performance measurement. And opinion should not be what we are guided, or what we are judged upon for quality of care. And I think Captain Barobossa from Pirates of the Caribbean got it right. When Elizabeth Swann was trying to get him to take her back to shore, he pointed out that the code was more guidelines than rules.
Not part of our negotiations nor our agreement, so I must do nothing. And secondly, you must be a pirate for the pirate's code to apply, and you're not. And thirdly, the code is more what you call guidelines than actual rules. Welcome aboard the Black Pearl, Miss Turner.
I think we've forgotten that guidelines are supposed to be that. They're supposed to guide us, but not be rules. We've turned them into rules way too much, and I think it's led to problems with guidelines and the lack of trust by physicians and lack of usefulness for many of these guidelines.
This video has helped you understand some of the common criticisms and limitations of clinical practice guidelines. Remember, if you have any questions, you can contact me through the course website or through the Contact Me section of my blog. Have a great day.